Hey y'all, so I just wanted to remind you of this. I was speaking with one of my clients and they were asking me about a relative of theirs, and they were having the back pain and some other issues. And so I gave them some recommendations and I wanted to share those with you, okay? Now, one of the things that came to mind is that one of the signs of low vitamin D is, or one of the symptoms, is back pain. And so this is something that's very common, and I'm really seeing increasing or adding in vitamin D with K2 help to really alleviate that whole issue there. But the back pain, the lower back pain, oftentimes is a sign of low vitamin D. And if you're taking vitamin D supplementation, get a good quality vitamin D and make sure that you're taking it with the appropriate amount of K2. You want to take those together with the version that's called MK7. And I've seen this really help in that area, having back pain. So that's the first thing. Make sure you're taking vitamin D3 with the K2 and enough of it. So the minimal amount is going to be about 8,000 IUs is what studies have shown, but the higher amounts are going to be even more effective for people that are overweight or obese and individuals that already have some sort of a chronic illness. Okay, so keep that in mind. Another thing with this particular individual is that they're very dark complected, and I wanted to remind you as well that when your complexion is darker, you have a higher level of melanin in your skin, that you need to take in more and receive more vitamin D, also in the way of being outdoors directly from the sun. And so I know many of us are indoors, but we need to get outdoors more. You have to make sure that you're getting some direct sun. Nowadays it's not that difficult, but midday is a great time to get out there if you need more sunlight. So get outdoors. If you have to get some reading done, or if you have to make phone calls, you can always do those outside. So another thing that I recommended for them was to make sure that they're doing core exercises, and this is another part. Now, I'm kind of gearing this directly towards males because this is very common for males to really focus on upper body. Now, males are typically stronger in their upper body than females are. That's just the way it is. And there's also this drawing, if they're going to exercise, that they do more upper body, would neglect the foundation, which is the legs, actually the core all the way down to the legs. And so I want to also encourage you to include core exercises. Now, in order to activate your core properly, you need to stretch. You can't have a functional body with a tight back. And when you add on resistance on top of that tight back and that lower body that isn't activated to the level that it can support the upper body load that you're doing, I'm telling you, once you get to the age 50, especially 60, it's very common to start to have these issues in your back because you have not activated your hips, you have not activated your glutes, your back is tight, and you're putting on all of this strain just for your upper body to look muscular. Do resistance training, but remember, do resistance training for function, okay? So I hope that was helpful, and have a good day.